Good day. I'm Chris Matthews in Washington. In today, of course, for Andrea Mitchell. We're following breaking news today out of Atlanta, where the 2 Americans infected with Ebola in Western Africa have been discharged from Emory University Hospital and declared disease-free. Just moments ago, Dr. Kent Brantley hugged and thanked all those who cared for him while he was in isolation for 3 weeks. He spoke about his friend missionary Nancy Wrightball, who was released as well from the hospital on Tuesday.
My dear friend Nancy Wrightball, upon her release from the hospital, wanted me to share her gratitude for all of the prayers on her behalf. As she walked out of her isolation room, all she could say was, "To God be the glory." Nancy and David are now spending some much-needed time together.
Well, joining me right now from Cleveland is Dr. Frank Esper. He's an infectious disease specialist at University Hospital's Case Medical Center. Dr. Esper, this is one of those great American stories about our medical ability here in this country. People come from all over the world to be treated here, whether they like us or not. We're the best. What does this say about the ability to deal, doctor, with this terrible disease, this frightening disease?
Yeah, I think one of the great stories about this is that we went and retrieved these individuals, these Americans, and brought them to our country, even with the angst and with some of the concern about the possibility of spreading the disease here within the United States, as low a possibility as that was. We were up to the challenge, and that we went over there and said we could help these individuals. Not only that, by bringing them to the United States, we had especially over at Emory and over at the Centers for Disease Control, we have the ability to truly monitor and get a lot of data that you're just not able to get in the fields over in Eastern Africa. We can look at their immune response, we can look at the virus response, and that way we can understand the virus a lot better and dedicate a lot more effort into specific medications to help these patients.
How do you project this ability to deal with a couple of cases Americans brought home here in very special circumstances with the public health question over in West Africa? Over there are people holding people in a quarantine situation, which looks pretty tough. And I wonder how the help that you've been able to do here in America, we've been able to do in America, will translate to how they deal with a much more of a public health situation in West Africa.
Well, there are several different ways that we have to attack Ebola and viruses like Ebola. There are certain ways that are just on the ground that are unique to the situation in Eastern Africa, the way to control the population, the way to educate the people who have very limited resources from the government and from the local population, that we are very fortunate to have much more rigorous infrastructure and medical support. So what we're going to get by helping these patients here, we're going to have a much better understanding at some of the much more detailed science, at some of the more detailed immune responses, so that we can help with making vaccines and that we can help with making medications that then we can send over there. But a lot of the support that they need are not just medical support, but they need infrastructure support, and they need the willingness to go over there and to help those people, to control them and to control the fear. And the fear sometimes is actually even worse than the disease itself.
What's the infrastructure that's required here?
Well, I think it's you know, the biggest infrastructure, I think, is in education, and to help the population to understand where this virus comes from, how this virus is transmitted, how to help people from getting infected themselves. A lot of the patients who become infected are because they are caring for individuals who are sick themselves, and so how to prevent, how to give them to understand what it takes, what is contaminated or what can be contaminated, what can be infectious and what isn't infectious. Also to give them, some sort of support from a standpoint of gowns, of gloves for clean water, for washing hands and things like that. Those are things that we can provide.
Well, the CDC, the Center for Disease Control, has released now a statement on those discharged Ebola patients. CDC has advised Emory University Hospital that there is no public health concern with the release of those patients. They no longer have Ebola virus in their blood and therefore pose no risk to household contacts or the public generally. There are no restrictions to the patient's activities of daily living here in this country. Anyway, thank you for joining us, Dr. Esper, on Andrea Mitchell's. Today we are also